Yeah, my name is Marianne Brodmann. I'm the head of angiology here at the Medical University in Graz, Austria, and I'm a vascular physician. The reasoning for the RESOLV-I trial is to test a new generation of bioresorbable scaffolds. The issue is that we had for a very long time no positive data about bioresorbable scaffolds. The only trial which was really very, very successful and showing us a positive impact was live BTK, and that has motivated also other companies to produce bioresorbable scaffolds and to test them, because in the below-the-knee space, patients with critical emphysema, we do not have a final resolution right now what to do. And so I think bioresorbable scaffolds will play an important role there. The MAGNITUDE Bioresorbable Scaffold is a new generation of bioresorbable scaffold. It's coated with sirolimus and has a high radial outward force and a good radial strength. The struts are very, very thin. They are below the size of others. The resorption is very slowly. So therefore, you have, for the time period where you need to have the outward force, the adequate outward force, and that might be the secret behind the good results we have seen so far. It also has a high flexibility, and that is also very, very good, because especially in the below the knee area where people are still do some kind of bending or whatever, it's very important to have also good flexibility, and the company is able to produce any length we want to have, or any length we want to have as physicians, just let's say it that way. We did patients with below the knee disease, and we treated them. It was a pilot study, so there is it's a feasibility study, so it's not a randomized controlled trial. We treated below the knee arteries in patients who were symptomatic of PAD, Rutherford 3 to 5, mainly in the proximal tibial arteries, because when we started, we had very short scaffolds and we had a very short lesion length, which was the parameter for the inclusion in the trial. And right now we have finished the trial. We see already long-term results, and they are really good. I have presented them at LINC, and the data are really good. The key findings are that we had an improvement in Rutherford category, which is really very important, especially in below the knee disease. So we had a very good clinical improvement, and we didn't have clinically driven TLR rates. So that means that at 12 months, after 1 year in this below the knee patient population, the scaffold is really working very, very well. What further research is needed? I think we need a larger study, an RCT, where we have a comparator. Right now, I guess the comparator will be BOWER, because this is the only worldwide, I would say, adopted and approved treatment option for below the knee. And I think this is the next step which needs to be done.